In the heart of Idlib province, the Maarrat al-Numan National Hospital stands silent, a haunting reminder of Syria's long and brutal war. Once a lifeline for tens of thousands of people, the hospital now lies in ruins, awaiting reconstruction nearly a decade after the airstrikes that destroyed it. Built in 1984, the Maarrat al-Numan Hospital was one of the region's largest and most advanced medical facilities, offering emergency care, surgical units, obstetrics, and pediatric services. For years, it served as the primary healthcare center for residents across northern Syria. But during the height of the conflict, the hospital became a target. Intense air raids by regime forces reduced large parts of the facility to rubble, leaving behind only empty corridors and shattered equipment. Drone footage from the site reveals the devastation: collapsed walls, abandoned hospital beds, and broken medical tools scattered in the streets. The wards that once treated the sick and injured are now filled with dust and silence. Residents recall the horror of those days. Mohammed Maari, a local resident, describes how airstrikes destroyed the hospital while it was still serving patients, leaving doctors and civilians trapped inside. "We lost everything: the doctors, the nurses, the patients. There was no time to escape," he says. Healthcare worker Hamza Alvan, who lived in Maarrat al-Numan his entire life, remembers the struggle to keep the facility running amid fuel shortages and equipment breakdowns. "Even before the bombing, we were working with almost nothing," he explains. "When the strikes came, the generators stopped, and infants in incubators died because we couldn't save them." The tragedy of Maarrat al-Numan Hospital is part of a larger story, one shared by countless Syrian communities whose medical infrastructure was systematically targeted during the conflict. According to humanitarian organizations, more than half of Syria's hospitals were damaged or destroyed during the war, leaving millions without access to essential health care. Efforts to rebuild have been slow. Limited funding, unstable conditions, and ongoing political divisions have stalled reconstruction projects across the region. Local organizations and international NGOs have pledged support, but progress remains minimal. Many residents now travel long distances to reach functioning medical centers, a journey that can take hours and cost lives in emergencies. Despite the challenges, hope endures. Volunteers continue to clean debris and salvage what they can from the ruins. Engineers have drawn up plans to rebuild the facility, aiming to restore at least a fraction of its former capacity. For the people of Maarrat al-Numan, reopening the hospital would mean more than access to medical care. It would symbolize survival, resilience, and the possibility of renewal after years of loss. As the sun sets over the shattered town, the damaged hospital stands as both a memorial and a promise, a testament to the lives once saved within its walls, and a reminder of the urgent need to rebuild what war has taken away.
مدينة معرة النعمان تعرضت لتدمير ممنهج من قبل النظام روسيا خلال سنوات طويلة. تم استهداف الأحياء السكنية، تم استهداف النقاط الطبية، المدارس، الأسواق، المرافق الحيوية حتى تنعدم الحياة. من ضمن الاستهدافات تم استهداف، أنا الشيء اللي بتذكره ما بنساه، تم استهداف سوق الخضرة. هذا السوق اللي كان يرتاده أغلب الناس في المعرة وبريف المعرة تم استهدافه بعدة صواريخ من قبل الطيران النظام، فصار في مجزرة.
فمعرة النعمان له رمزية كبيرة بالنسبة لأهالي المدينة ولأهالي الريف المحيط بالمدينة، لأنه كان يخدم قطاع كبير من المدن والقرى المحيطة بمعرة النعمان. طبعا تم إنشاؤه قبل الثورة وتشغيله فترة قريبة. أثناء تحرير معرة النعمان بالثورة تم استهداف المشفى من قبل النظام البائد وتعرضه لأضرار أدت لخروجه عن الخدمة.